My name is Ranjit Rao. I'm a urologist here at the Epworth Hospital in Richmond. Urologists are surgeons. We operate on anything to do with the urinary system, so the kidneys, the ureters, the bladder or the prostate. There are a number of different conditions that urologists deal with on a day-to-day basis, and some of those include kidney stones, kidney cancers, prostate disease such as benign enlargement or cancers of the prostate. And on my day-to-day work, these would be the bulk of the conditions that I'd look after. So today we're going to talk about kidney stones. And kidney stones are really important, one, because they cause excruciating pain. So anyone who's had a kidney stone before will say what terrible pain it causes. In fact, there are women who've had children who've also had kidney stones, and they say that childbirth is much better and easier than having a kidney stone. Often it just strikes in the middle of the night, 1 or 2 o'clock in the morning, and the patient wakes up with severe pain and just can't get comfortable. And the patient has to call an ambulance, get to the hospital for morphine and narcotic analgesia. So kidney stones, the number one factor we know that leads to kidney stone formation is dehydration. So basically not drinking enough water. So if there's one preventable, reversible factor that can prevent the onset of kidney stone formation, that's drinking enough water. So we recommend 1.5 to 2 litres per day, particularly for anyone who's had a kidney stone. Kidney stones, they start off as small crystals, and then those crystals generally congregate or aggregate and form small stones. And so then a 1 millimetre becomes a 2 millimetre. Eventually it gets to a size that's big enough that if it drops into the ureter, which is the pipe between the kidney and the bladder, it will block the pipe, and that's what causes the severe excruciating pain. So in terms of preventing kidney stones, or if you've had a kidney stone in the past, the single most important thing is drinking enough water. So 6 to 8 glasses of water per day, 1.5 to 2 litres of water per day. There are other things in the diet that can reduce stone formation, and these include things like less salt in the diet, and a lot of us in the Indian community add a lot of salt to our food. So less salt is important, having more fibre in the diet, less red meat. There are certain foods that contain a lot of oxalates, and calcium oxalate is the most common kind of kidney stone, 85-90% of calcium oxalate. So foods such as spinach, tomato, asparagus, rhubarb, strawberries. Some of those are quite common in our Southeast Asian cuisine. So reducing, you don't have to avoid completely, but reducing things that contain a lot of spinach or tomatoes. Often we're asked about calcium as well, whether calcium should be excluded completely from the diet, including calcium supplementation, and we generally recommend that a small amount of calcium is included. Because the body gets confused if calcium is eliminated, the body responds by trying to absorb more oxalate. So these are the main things in the diet: less salt, more fibre, less red meat, less oxalate containing foods, and a normal calcium diet.